we have to advocate for our children. If you're a carer, if you're a parent, if you're in that position of responsibility, it's your role to advocate. It is hard sometimes when you speak to a doctor and they tell you that everything looks okay. And I think it's important to have that communication and build that trust with the doctor and say, well, look, I will take your advice. What would you like me to do next? And crucially, if X, Y, Z doesn't happen, when should I come back and what should I be looking at? What I think is important is to remember that children, we sometimes underestimate.
Yeah.
We sometimes think they don't know, we'll just do everything, we'll continue. But actually, I think what's amazing for a parent, if you're listening to this, is your child is with you on the journey. They're the one who's actually in the situation. They would want to be supported by you.
Hello, I'm Jo Elvin, former CEO of Children with Cancer UK, and as part of our Ambassador series, I'm delighted to talk with Dr Mo Abbas Khaki about what being involved with the charity means to him as a medical professional, as well as sharing some practical and personal advice from him for families living with a cancer diagnosis. Dr Mo, thank you so much for being here today. I know from our chats and our work together how passionately you feel about giving back and being an active part of society in all of this. How do you apply that to your relationship with the charity Children with Cancer?
I think when I first learned about the work the Children with Cancer were doing, and the concept and the mission statement, it will continue until every child survives and thrives. I was really taken in by it. It's an amazing idea, an amazing mission, an amazing vision to go for. And then I think when you look at that and think about yourself and reflect as a medical professional and think about how you can contribute, think, well, I've got to get involved somehow. I think the first thing was re-educating myself, learning about how much of this impacts so many people. And then when you see that in your practice and realize that there are so many children who are affected, but then it's not just the children, it's the families and the communities and their friends and their networks. And I think when that happened, I thought, look, I want to get involved. I want to be an advocate. I want to speak up for them. I want to support children and families by creating materials that are educational, that can go out and explain the journey, sharing success stories, sharing support, showing where we can actually say, well, look, we're here to support you. We're here to engage. I know it's a tough system. I know that what you're going through is really hard at the moment. Here's how to navigate this route. Here's how to help with things that you're struggling with, finances, coordinating time, even, and I'm sure we'll get onto this later, welfare and relief and supporting children in trying to find some normalcy in this really strange and evolving and difficult time.
Yeah.
I think the work that Children with Cancer are doing is so amazing, and if I can contribute in any way, I feel honoured.
Well, we are honoured to have you as part of our team. I can say that with all my heart. It's really difficult, isn't it, to understand until you're going through it, what this is like. It's like entering into a completely alien world the minute someone says your child has cancer.
Yeah.
What do you think it's important for parents to know from that day one of that journey?
The strongest message I would give is to say that you're not alone.
Oh.
I think when that happens, that diagnosis comes, the world comes crashing down. And it's so easy at times like that to think, okay, it's me and my child. We're doing this, me and my husband, my wife, whatever it might be. We're going for this, we're supporting, and forgetting that actually there's a whole group of people here to support. There's a charity, a whole charity saying, hey, we're here. We are waiting for you to come and let us know that we can support you. I think that's the first thing. I think the other thing is, of course, more maybe practical elements. You know, the first thing to think about is, okay, you've got this diagnosis and it is going to rock at you. But hey, let's now look at how we can educate ourselves more about the condition. I think when you're a parent and you hear the word cancer, your mind goes blank and you can't think, and it takes some time to register that. But part of this is actually educating yourself and your family, and particularly your child, and saying, well, look, how can we learn more about this condition?
But how do you do that without terrifying yourself with Dr. Google?
Yeah, absolutely. Well, this is something we're going to work on, producing more information that's easy to understand, and we'll have all that on the website, and we'll create short clips and videos, etc. But I think you're right. I think, how do we do that? Well, first of all, you've got your specialist, and they will be the one who can guide you through all of the different support information, the teams that are there. Sometimes you might speak to an oncologist and think, right, that's what he said or he or she said. But actually, there are other people there. They'll support you through the nurses, the support staff. There's a whole team. Exactly what you said is a really important point, though. There are support networks for cancers. There are online groups and forums where you can share your concerns. And everyone is so welcoming. No one is judgmental. Everyone is going through unbelievably different circumstances that you'll be amazed at how forthcoming people are. And I think, of course, there's something really important, which is then looking at how we communicate with the child. Now, it depends, of course, how old that child is, but having that open communication with the child and saying, this is what's happening, we're here together, giving them your strength and taking strength from them. It's amazing how resilient and strong children are.
But it's also, you touch on a really important point, because I think that a lot of people lump cancer in as this sort of like this blancmange, this unified thing. But for children, it's a completely different disease than for adults, isn't it? So how do you approach that? What can you help people understand why it is so different for children?
What you have to remember is that as adults, we tend to jump 10 steps ahead. Someone says cancer, we've jumped to chemotherapy, we've jumped to radiotherapy, we've turned to palliative care, we've turned to loss of life. All these things jump in our mind. Children are not able to see that side of things. They're very simple. They like to, depending on the age, of course, but, the younger children there, they like to take things as they come, try to understand it. And of course, one of the things we have to think about is their maturity and how they can handle that. What I think is important is to remember that children, we sometimes underestimate them.
Yeah.
We sometimes think they don't know, we'll just do everything, we'll continue. But actually, I think what's amazing for a parent, if you're listening to this, is your child is with you on the journey. They're the one who's actually in the situation. They would want to be supported by you. They would want to have that open communication with you to know what's happening. And actually, all of us, when we know what's coming ahead, we're much stronger. And also it allows you to then advocate for your child. Sometimes children and all of us have moments where we're in front of someone who is more senior, who's older, who's saying, well, this is what we're going to do. And they may be even the friendliest face, but we don't have the voice to speak. As a parent, you can say, well, I spoke to my child and he or she said, they would love to do this. Could we delay this by 3 days for the start of this because they want to go to, something, and children are like that.
Yeah.
And if we can give them that feeling that they have autonomy, that this isn't happening to them, but they're going to be part of this process and part of the survival, that's a beautiful way to approach it.
And again, you sort of preempted my next question, because it's like when you were talking about there's the treatment, there's the medicinal side, obviously, of the whole thing, but there's also the emotional and the psychological side of it. How important are the well-being projects that we work on, the days out, those things?
Oh, these are so important. Human beings are not just physical beings. We are emotional, social, psychological creatures. And children are no different. Children are going through the same journey. And actually, sometimes it's really hard when we're the adult and we're trying to take charge and look at things and say, this needs to be done and take some order. But actually, children are going through it too. And they really need that support. They really need those days out to forget that they're going through this, to relieve that stress, to get it all out of them. They need those peer support sessions to see that, look, I'm not alone. It sometimes happens that we think the diagnosis happens as adults, and now my family unit, me and my child, we're on our own. That child is also part of that picture. And they need to remember that, hey, you're not alone. There are other children who are going through this, and guess what? They're happy, they're smiling, they're going to be with you. This is your group, and we're going to make it together.
Wow.
I think that sense of normalcy, that sense of this is happening, I'm going to go through some treatment. It might have side effects, might do various things, but I can still try and live a normal life.
And have good days in with the bad ones.
Yeah. And I think that's actually one of the key points that I really want to make really clear to parents and children and anyone who's watching this, which is to say, this is a journey and there's lots of information, there's lots of plans, there's schedules of chemotherapy and radiotherapy and everything that's going on. But one of the key takeaways is try, and I know it's hard, and I'm saying this from the hindsight and position of a doctor and advocate, but I'm saying this with someone who's looked after patients as well. Try your best to be present in the moment and celebrate the small successes, because that's how we will get through this journey together.
Yeah.
It's so many things happening. There are so many things happening. There is so much information. There is so many different scheduled appointments. Sometimes we forget that actually, let's be present with our child and our parent and our family. Let's be present and let's celebrate that we've got through that cycle. We've done this. We've cleared this marker.
Yeah.
And just live in the moment.
I think that's really good advice. I've got one last question, which I think might be probably, I don't know how fair this question is. It's quite difficult, but I have spoken to parents who have struggled to get a diagnosis, sort of being eye-rolled by successive doctors or nurses when they're genuinely concerned about something. What's the way to speak to a doctor, in your view, if you really think something's not right with your child and this is something that they need to investigate?
I think this speaks to the heart of a lot of concerns people have. And I think the way I would say it is, my training as a doctor is to say that patients, parents, they have a sort of sixth sense, a spidey sense, if you will. They know when something's not right. And even though this might sound strange, if you examine a child and everything looks great and the examination findings are all normal and the history sounds okay, but the parents are concerned, that in itself is a strong enough marker for me to want to do something. So I think there's a few things. I think the first thing is, if you're a medical professional, healthcare professional who's watching this video and thinking, well, I saw a child, I wasn't sure, but the parent was concerned, trust the parent. They know that something's not right. It may not be cancer, but it could be something else. That's the first thing. And I think if you're a parent, as we came back to and we spoke, but we have to advocate for our children. If you're a carer, if you're a parent, if you're in that position of responsibility, it's your role to advocate. It is hard sometimes when you speak to a doctor and they tell you that everything looks okay. And I think it's important to have that communication and build that trust with the doctor to say, well, look, I will take your advice. What would you like me to do next? And crucially, if X, Y, Z doesn't happen, when should I come back and what should I be looking out for? So have set plans with the doctor. I'm going to do this, as you mentioned. I'm going to make a diary of my symptoms. I'm going to take this medication. I'm going to do whatever it wants. But if things are not better in X, Y, Z, what will be the plan? When we make that treatment plan, that helps so much because there's often fail-safes. So, for example, when there are issues that we're not quite sure about, what we'll do is we'll do maybe a trial of treatment or a diary of symptoms. But we'll always agree, in 2 weeks we do this. In 2 weeks we'll do blood tests. If the blood tests are not normal, or if something's not strange here, and there's always a cut-off point where we'll say, well, actually, we need more information now. I think that's the really important part. Remember, doctors are humans and they will try their best, but also they'll make mistakes. And that's unfortunately just part of life. The best thing we can do is try to keep an alliance and work together. Respect each other, but make sure you remember to advocate for your child, because ultimately, I genuinely believe that parents really understand their children, and when they say something's not right, more often than not, I found they're right.
Thank you so much, Dr. Mo.
My pleasure. Thanks so much.
Thank you for watching, and thank you to Dr. Mo. If you want to find out more, please do head to our website, childrenwithcancer.org.uk, and I hope you'll join us again soon.